and medical system, we can really make a very, very positive, real impact in people's quality of life. And then we're going to wrap up with Victoria's children, Jet and Gage, which are, the two boys are hemophiliac patients. So with that, I'd like to ask Jana to come up here and tell us a little bit about your own experience and your son, Tucker. Jana?
Thank you, Representative Seal, for allowing me the opportunity to share our story. This is a picture of Tucker. He's 15. Tucker was born 3 months early. He spent the first 4 months of his life in the NICU. We are access users. Our family are access users. My husband and I both work. And if we did not have access helping us with our health care for Tucker, there would be times that we would be unable to get the quality of health care that he needs in order to survive several times. But Tucker, like I said before, he was born 3 months early, and he has a brain injury from his early birth. He has cerebral palsy. He is non-ambulatory. He will never walk without assistance. He's total care. We do everything for him. We change him, we feed him, we take him from room to room, we provide assistance with schoolwork and things like that. The one good thing is Tucker is very bright, and he's very funny, and he loves us back. He's a lot of work, but it's not hard work. The way that Access has helped our family many times in the past is because Tucker was in the hospital for 4 months. That was pretty significant. He survived, and now he's 15, and since then he has survived 3 surgeries, subsequent surgeries that sustained his life. Without our Access coverage, we would not be able to afford those surgeries. There's absolutely no way we would be able to afford them, be able to live and provide a home for our other children. We have 3 children. My oldest daughter's 20 and my youngest daughter's 12. And so we appreciate your work, because it is without that it would be very, very difficult for us to be able to take care of them. So thank you.
Jana, thank you. And I just wanted to reiterate, this is a photo of your son?
Yes, yes. Sorry, I'll turn it around. This is Tucker. He's 15 now.
And you were mentioning several of the treatments that you've been able to get through Access. If you didn't get it, Tucker may not be with us today.
Definitely. And not only from that, but also it's also quality of life issues for him, because he has CP, the type of cerebral palsy that he has. There are also other surgeries that we've needed to help him to be able to care for him because of his non-mobility. Also equipment needs. We've needed durable medical equipment. His wheelchairs. One wheelchair can cost thousands and thousands of dollars. He's only had 2 wheelchairs his entire life. We've been vigilant in caring for them and making them last for a really long time, but without them, that's his mobility, and that is another support that we've been able to use.
Thank you.
Thank you.
Next, you're going to hear from Mr. Phil Hart, who is very much involved in the hemophilia community, and I'm just going to go ahead and let Phil tell you about it. Phil, would you please come over here?
Thank you very much. Those of us in the hemophilia and bleeding disorder community really, really appreciate the efforts of Representative Seal in uncovering ways in that to handle fraud and abuse in the healthcare system, rather than, as some of the other folks around the state, like with Proposition 204, are recommending of eliminating around 280,000 people off of the rolls of Access. This would adversely affect my family too. And I want to tell you a little bit about my son, Ammon. Ammon is now 21 years old. And the preventative, he is currently on preventative infusions of his missing factor VIII. Without these preventative infusions, well, let me give you an example. When Ammon was 8 months old, he had a spontaneous spinal cord bleed, which literally killed him. And we had to resuscitate him to bring him back. And we were treating on a as-needs basis then. But for the last 5 or 6 years, through the help of Access, we have been able to have him on preventative treatments. They are very costly, but he is with us, he's a fighter, and we don't know what we would do without the assistance that we are currently getting from Access. And he is one of those 280,000 people without any children who are, could potentially be cut from the Access rolls, and to go back on a treat as needed for Ammon would mean his annual cost right now, doing it preventatively, are approximately $1.7 million a year. However, we're talking 10, 20, 30-fold over that if Ammon were to treat instead of preventatively, where he has not had a bleed for 5 or 6 years now. But if he were to have a bleed, which he does spontaneously all the time because of his severity, he doesn't even have to be involved in anything. His bleed starts spontaneously. But because of this, his cost would be 100-fold if we had to go into the emergency room, and the state is going to still be picking up those charges. And so our plea to you guys and our support for Representative Seal and others is that to please see the need for eliminating these unnecessary things of fraud and abuse in the system, and because there are individuals, there are families who it is a dire need to remain on the Access rolls and to continue receiving this needed treatment for a hereditary disorder. And so once again, I'd like to thank Representative Seal for his efforts in spearheading the identification in that of ways to eliminate this fraud, as opposed to cutting people who are critically ill and who need this medical coverage from the rolls. Thank you very much.
The last lady you're going to hear from today is Victoria, and a little bit about her sons and what they go through. So with that, obviously they have space, maybe.
Yeah, let's do Jet, they can't see you. This is my son Jet, he's 7. This is Gage, and he's 4. They were both born with type A severe hemophilia. So for the first 2 years of Jet's life, we weren't on preventative treatment, but since he's been 2 years old, we were having emergency room visits almost every week, and every few days it seemed like something was going on. So we decided to start preventative treatment, and through the help of people at the Truman Center and the hospital, I've actually learned how to do their preventative treatment at home. So we're not having to use nurses and doctors and facilities and all of that. They are both on Access, so any of the preventative treatment that we get, the medicine that we get, is through Access. And again, you know, like Phil has said, and things too, without having Access available, there wouldn't be any other way that I could pay for the medicine that they need. So it really is a lifeline for us, in the fact that you know, it is you know, possibly life-threatening what my children have. So just being able to have access to the medicine, you know, and having this incredible technology that's come out too. Sometimes the fraud, it really makes it a lot harder for people that really need it, you know, and we really do. So appreciate all your efforts, definitely all of you. So can you say hi? No? Jet, what do you want to say? You know what to say.
I need my medicine.
Thank you. Thank you very much. I just wanted to wrap up by saying that you've seen here today, you've seen a technology that has been modified by ASU right here in our own backyard. Arizona has always been on the forefront of pioneering, and here we are again in the new age, pioneering technology that will make the quality of life much better here in Arizona and potentially across the nation. There's budget provisions that may remove this very vital technology, which I'm sorry to have to tell you that may very well happen today, and we're fighting very hard to make sure that they stay in the budget, which is why I've asked you once again to contact the governor. The governor's office can be reached at 1-800-253-0883 or a direct line of 602-389-0000. 542-4331. For those of you who have seen my work as far as fraud reduction, there's no better time than now for you to do something. This single measure may not only systematically balance our budget, but make sure that proper care is delivered to people who truly need it. Personally, I'm here right now. My brother-in-law is on his deathbed, and I'm here to vote this budget out. It's the right thing to do, but I'd like to be out of here tomorrow, immediately. This budget's probably going to get wrapped up and wrangled up in various different things, but I think probably none as important as the very measure I'm asking you to support today. So I want to thank again ALARIS and the engineers that maybe at the time that they were working on it in the late hours of the night, they may not have realized the true impact that they're going to have not only for the people of this state, but the people of this nation. And the business community and Mr. Jeremy Kellstrom, who's going to, an idea is only as good as your ability to implement it. And from what I see from this gentleman, it's going to be implemented in a very large way. So I wanted to thank ASU and the ALARIS project for developing this. And I wanted to thank those of you who came here today and shared with this community and shared with the world that we're going to present this to, your personal stories about your own children and what you're going through. Make no mistake that the good news with the internet, we're going to be able to get this message in a much broader context. And so with that, I want to thank all of you for being here today and wanted to urge you one more time to contact the governor's office to tell her that you support these kind of ideas. 1-800-253-0883 or a direct line 602-542-4331. My name is State Representative Carl Seal, and I thank you for your time.